recovering from a hospitalization can be a challenging time. Aurora St. Luke's Medical Center offers a team approach to rehab through their Inpatient Rehabilitation program. As the largest inpatient rehab program in southeastern Wisconsin, we specialize in helping people who have had a disabling illness, disease, or injury become as independent as possible in preparation for discharge home.
Inpatient rehabilitation is an in-hospital program that is designed to help a patient kind of regain their independence that was taken from them because of injury or illness.
Aurora St. Luke's inpatient rehab program provides care to people with complex medical diagnoses and conditions. Our unit has private rooms with technology in place to manage a variety of medical needs. We strive to create a healing and encouraging atmosphere for our patients and their loved ones.
We make an assessment to see if they meet criteria in order to be admitted to the rehab unit. We see if they can tolerate an intensive 3-hour program. We see if they need the medical care, and we also have to look at where they go once they complete the rehab program. Usually the patient and family are there because we're going to be relying on family a lot to provide additional help for the patient. Once the patient gets to the rehabilitation unit, we work with the patient but also family to keep them abreast as to how they're progressing. As they progress, they may need more help, they may need less help. Sometimes their home environment needs to be assessed. They may be able to return home, or they may need to return to a family member's home because of the architectural barriers that are present.
On the rehab team, we have, there's the occupational therapist, there's the physical therapist, I'm the rehab nurse, there's the physiatrist, the rehab doctor. We also have social work.
Based on the patient's needs, they may also be seen by a speech and language therapist, a rehab psychologist, a recreational therapist, or a dietitian. And of course, central to the team always is the patient and their family.
We collaborate with everybody to try to get the best possible outcome for the patient. So starting with, medication teaching, bowel and bladder, making sure, they're voiding and they're having normal bowel movements. Skin is a big one too. We have a lot of surgical patients, so making sure, the surgical incisions look okay and the pressure points look good.
Our goal is to build the skills necessary to return home into the community. And this involves practicing and developing the skills for everyday life, things that we typically take for granted, like getting in and out of bed, showering, getting dressed, walking or using a wheelchair, cooking a meal, eating a meal, or being able to communicate your needs and express yourself.
This is unique in the sense that there really isn't just one voice that determines is this person going to get better or not better, is this person going to need this therapy or that therapy. It actually becomes a consensus decision.
You and your family are important members of the team and play an active role in your recovery. We encourage your support partners to ask questions, attend teaching sessions, and be part of the rehab process. Our goal is to make you and your support partners feel prepared to be safe and successful as you transition home.
Team members are not only the physicians, the therapists, the nurses, but also the patient and the patient's family. And it's just as important for them to be involved in the direction of their care as we provide treatment for them.
I think that the fact that they allowed my family to be so involved was the best thing that's ever happened to me. They really appreciated the information that they gained because they know that it helped me ultimately, and that's all they wanted at that point.
Aurora St. Luke's Inpatient Rehab Program is accredited by the Commission on Accreditation of Rehabilitation Facilities, which is awarded to rehab facilities based on state-of-the-art standards of performance. As a result of this accreditation, our patients experience better outcomes than many similar programs in the region. Our team of experienced rehab specialists is dedicated to helping maximize your recovery and successfully transition you back home and into the community.
I love working with the team that I have. They're a great, outstanding team. I like the communication, the exploration of the, I guess, the viewpoints that they bring to the table as to how a patient functions, how a patient moves, and the brainstorming that usually occurs to try to figure out how can we get this patient from a dependent state to an independent state.
If you would like additional information about our inpatient rehab program, please call 414-649-6062.